Hey, everybody, what's happening? Good morning to you, or almost good afternoon. This is another awesome episode of the Hope Health Corner. My name is Dr. Kramer, and welcome to today. To you, or almost good afternoon. This is another awesome episode of the. And so I'm getting a little feedback here on my Facebook stuff. Let's get this thing full. Okay, so anyways, here's what's happening. We are talking today about TMJ, temporomandibular joint. That is the joint that sits right here, the jaw joint that you guys may or may not have ever had any discomfort or issues with. I know myself in the past, I've had some of it just because of the amount of dental work or the orthopedic work that I've had done on my jaw, and my left one clicks quite a bit, right? It makes a lot of bit of noise. And it just so happens I ask my dentist whenever I go in, hey, doc, what's going on with this? He describes to you what's happening and says, if it ever becomes painful, let me know. And they may have some things they can do to work through it to help you out with it from that standpoint. However, today I want to talk about it from a perspective that many of you may not have thought of. And this conversation or this topic came up over the course of the last month, in which we've had several patients that have called us about TMJ pain and asking us if it's something that we can help them with. And it just so happens that after doing some research and studying within the upper cervical field, it becomes a very clear way that we can help someone. Now, do understand, I need to preface this, that if you've damaged this joint right here, then yeah, you're probably going to need some work done on it, but it can also be an issue going on with your neck. And today we're going to dive into that a little deeper. So before I get started, let me get my screen share going on over here so we can get rolling. And awesome. So, here's what's really fascinating to me. The people who've been calling in have been talking about TMJ. They've been talking about it from a standpoint of, it's causing this radiating headaches into my, on my left side of my face. They talk about it in this sign of facial pain, being like your facial nerve, maybe Bell's palsy where your face droops. They've talked about it from being able to bite into solid foods, and it has limited their capacity to be able to just function in daily life. I don't know how I would do with a life of just drinking smoothies. I'm sure if we had to, we would figure it out, but it would probably get a little bit boring. So what we're going to do here is we're going to work on a few things that we're going to dive into. And our first thing that we're going to talk about today is what is the TMJ. Once that's established, and once we understand what that is, we're going to talk about nerves for the TMJ. And then after that is done, we're going to discuss nerves from upper cervical spine. And number 4, we're going to tie it all together. So for those of you who don't know and don't really understand where we're at on this, the TMJ is your jaw joint. And so if you look at your face, on the side, you will have your jaw, right, with your teeth down here. And then you will have another joint in your skull. And this is going to be the TMJ joint. Now, within this, you have a disc that sits right here. And that disc is responsible for sliding back and forth over this joint as you open your jaw, when you open it and when you close it. And so it is just a sliding mechanism that moves back and forth. And when people get things such as lockjaw, it's typically because this disc has moved into a position in which it is out of the joint in place. And so this is running like this. And so as a result, it's locked in place, and we have to maybe relocate the jaw, maybe remove it, move it into a different place, et cetera, to get it back into optimal position. Now, what's really unique about this joint is that it is a highly sensitive area as it relates to nerves. And in this, if we are going to talk about it, we know and recognize that 8% of your entire sensory nerve distribution in the body originates at this joint. And if we were to go back in evolution and really dive into understanding what this is, survival mechanisms is part of our evolution. And we have to be able to chew and eat food. We have to know if we can't bite down on it, if it's too hard, or we have to know if we have a problem with eating, because that is our number one survival mechanism for fueling our system. So it only makes sense that from survivability perspective, this area would have a heightened neurological distribution because it is one of our primary resources for survival in the system. And so what we see here is this understanding that we have the TMJ, and now we're going to look at the nerves for the TMJ. So at this point, you have all these nerves that are coming in here, all these nerve endings, right? So we're going to move down here a little bit, and we're going to draw a little bigger picture. So if we have our jaw, we have our TMJ coming through here. What ends up happening is you have all these nerves that run into this joint, and they all conglomerate and move backwards into the same spot in your neck. And at this point, there's a little area, and it is called your trigeminal nucleus. And the trigeminal nucleus is a branch of cranial nerve number 5. And cranial number 5 is responsible for mastication. That means chewing, right? So that is what it is responsible for. It controls the nerves that allow you to bite down on food. And so what this does is it allows us to know that if we have a problem with our TMJ, it'll send a sensory signal back here, and that signal will go to your brain and it'll tell you, ow, my jaw is hurting, right? It's a pain fiber. Or it'll say, man, I can't bite into that. That's too hard. Or maybe like it's a little weird tasting, right? If you're eating some chicken wings and you bite off a piece of the bone, you recognize that you can't crush that, right? There's these things that happen with your TMJ. However, when this becomes a chronic pain issue, and we recognize that it is there consistently and consecutively, right? Meaning that you grind your teeth, you have this really tightness in your jaw, you can't open it to a certain degree. Maybe you have lateralized facial pain. Maybe you have numbness in your face. Maybe you do have Bell's palsy, or you have facial nerve palsy, or maybe you have like just a dislocated jaw and you have these problems that have happened year over year. And you wonder to yourself, why isn't this ever getting better? And that's a really great question, because what I have seen and what I have learned is that if we talk about the trigeminal nucleus, we also need to talk about the bones of your neck. And if we look at the very top bone and the very second bone of your neck, so here is C1, C2, they also have a nerve integration point that goes in right here at your trigeminal nucleus. And so oftentimes, if we have a injury or we have a trauma, or let's say that you spend 8 hours with your head extended in a dental chair and is leaned back to one side, and it causes this bone to move to the right or to the left, it's going to put stress on the nerves that go into the trigeminal nucleus. Now, bear with me on this, because this is where we get into a really interesting place in the body and in the brain. We understand that both pain fibers coming from the TMJ and coming from your neck all originate in the same place. Thus, your brain cannot distinguish where the issue is coming from, right? So that means you could have a jaw problem that is related to the neck. You could have a neck problem that is related to the jaw. You could have both happening in the same occurrence and resulting in you dealing with the frustration of not being able to eat solid foods, the frustration of having that facial paralysis, the frustration of not feeling normal, of having this unrelenting facial pain that just will not go away. It just won't quit. And so what we find in our practice is a very easy way to measure if this is indeed a neck problem, and also if we can indeed help you alleviate your TMJ symptoms by correcting the way that your neck moves. And so what we do is we come in and we run, as you know from our previous videos, we run a graph. And in our world, we are concerned about autonomic function. The autonomic system is broken down into 2 parts. You have your fight or flight, and then you have your rest and digest. In both cases, when these are overstimulated, it will cause us to move into a state that we call dis-ease. And when you are stuck in a state of dis-ease, you will have a graph that looks something like this. And when you have a squiggly graph, it lets us know that our top bone of our neck is the problem. It is indeed the culprit. It is indeed the issue. And we understand that if you're dealing with a symptom that is TMJ related and you get this graph, then we understand that the problem that you're dealing with is indeed a C1 issue because the brain is unable to differentiate what is happening with the trigeminal nucleus. So in our practice over the last 2 to 3 months, we've had several wonderful new women come into our practice, all dealing with TMJ pain. And as a result of being under care over the course of the last 6 weeks, we've been able to move into solid foods. We've been able to alleviate the headaches, the radiating facial pain. We've been able to get back to having a quality of life in which you no longer have to sacrifice your health because you haven't been, told really what is going on with my TMJ. How do I fix it? And what do we do to improve it so that I no longer have to deal with this in my day-to-day life? So when we tie it all together and we draw it all back in, we understand that the TMJ, being the temporomandibular joint, the one that we use to chew, has nerves. These nerves go into a spot in the back of our brain at the same spot that the nerves from our neck integrate. We understand that the brain doesn't know where to process the pain that comes from either one of these joints. And as a result, you could have a neck problem causing TMJ pain. You could have TMJ problem causing neck pain. And so what we do is we assess the neck to find out if indeed it is a neck problem. And if it is a neck problem, through a series of adjustments, we give you alleviation of not only your neck pain, but also alleviation of your TMJ issues. And we restore function to allow you to have a better quality of life, to allow you to continue to love doing the things you do, going out to eat, not drinking smoothies for the rest of your life, and actually not having to deal with the day-to-day pain that is crippling you from thriving in this life. Let's go ahead and close this out here because I'm going to move on. We're going to stop this share. And so that's what I got for you guys today. It's a little bit of information. It takes us about 10 minutes to cover it. And my ask for you is this. If you know somebody that is navigating TMJ pain, I would love to have a conversation with them. I would love for you to invite them into our group and then tag them in this training so that they can have a better grasp, maybe a better understanding of why they haven't gotten better and why their TMJ has not improved. And now also, if this is something that's really interesting to you, comment below with the hashtag live. Let me know what you learned from this, and let's get the ball rolling with helping get sick people well. You all have a great rest of your day. Next week, I'm going to be back with a new guest. Her name is Kay Moore Macros. We're having her come on, Krista Moreland, and she's going to be talking about women's health. And she's going to be discussing with you really the nutritional components that will allow you to better function instead of having to subject yourself to the yo-yo dieting that the westernized society sells. You guys have a happy and safe 4th. God bless. We'll talk soon. Peace.